Welcome to today's lecture on the Model 3, and today we are looking at section B of um, Model 3, and we'll be talking about the part 1. In fact, section B will be two parts, part 1 and part 2. For today's part, we'll be looking at Introduction to Rational Drug Use, and the part 2 will be about precautions in drug use. My name is Pam McBain from Flexens Health College. Now, this section discusses the problems irrational use of medicines has on the patient and the community as a whole. It is very important we understand that as an MCA, our role is to ensure that all medicines are properly used, and we should take a stand against irrational dispensing of medicines. And once you start working in a pharmacy, you can see, especially in this part of country, in the villages and elsewhere, people buy medicines anyhow, and once you decide not to sell, sometimes you become the enemy of your client. However, the right thing is supposed to be done. At the end of today's lecture, we are going to understand why we are supposed to ensure that patients get medicines that are appropriate to their clinical need or to the problems that they are having. We are supposed to ensure that medicines are distributed equitably. We don't allow anybody to hoard medicines where patients that really need their medicines are not getting, and their diseases are getting worse. Now, worldwide, more than 50% of all medicines are prescribed, dispensed, or sold inappropriately. And this is a big challenge. What it means is that if we have medicines that are being prescribed by medical doctors, about 50% of the medicines that have been prescribed to the patients are inappropriate. We are not supposed to dispense. And rather unfortunately, this is very common in this part of the world, in Africa and developing countries. It's normally because, of course, the facilities may not be available, or the pressure on our health system is so much that doctors may not want to go through the whole protocol of requesting for a lab test. Sometimes, before we give an antibiotic, we are supposed to request for antimicrobial sensitivity tests. And all these things are not being done. Maybe because of also costs that our people are not able to afford. And our pharmacists to do the same thing. When somebody comes with a condition, for example, if you think it's an infection or malaria, how many of us will do the malaria test before we take our anti-malaria? The government have pushed, the Ministry of Health has pushed that before we test for malaria, the test should be done. Anytime we are treating a patient for malaria without testing to see whether the patient has gotten malaria, anytime we are treating, it's possible that we are giving the wrong medication. The patient may not even be having malaria. It could be meningitis or enteric fever or any other type of fever. Then we will conclude that once the patient is having fever, it's malaria, then we treat. So medicines are being dispensed inappropriately, medicines are being prescribed these are inappropriately. When you go to our markets now, the popular markets here in Ghana, we can see people selling medicines, even though they are not even trained. Now, for the 50% of the patient that, let's say, they even have the correct medicine, they have been diagnosed with malaria, we are giving them malaria. About 50% of those that have gotten the right medicines will also fail to take them correctly. So assuming you're supposed to take a malaria medicine and you're supposed to take 4 tablets in the morning, 4 tablets in the afternoon for 3 days. Most of us will take the 4 morning, 4 afternoon for one day. Day number 2, we only take 4 in the morning, we forgo the evening dose. The third day, we don't even take it at all. So about 50% of patients also fail to take the medicine correctly. And this has placed a lot of pressure because once we are not taking our medicines correctly, the disease may not be well treated. And once the disease is not well treated, this patient is coming back to the hospital or to the pharmacy to come and buy another medicine. And that could be a problem. Also, we have about 1/3 of the world's population that lacks access to essential medicines. And this group may go up to 50% in the near future. Well, what it means is that if you take the world's population, let's assume for simplicity that the world population is, let's say, 9 billion. I'm just assuming. Okay, I know it's around 6.7 billion to make our calculation easier. Now, assuming we are 9 billion and we divide it by 3, okay, what we are saying roughly is about 3 billion people don't have access to essential medicines. When you say a medicine is essential, these are medicines that are needed to save lives. Okay, so we are talking about antibiotics, we are talking about antifungals, we are talking about HIV/AIDS medicines we are using to treat bacterial infections. We are talking about medicines for diabetes, medicines for hypertension. These are essential medicines, and we are saying that about one third, 3 billion people all over the world don't have access. It's not that they can't buy it, but they don't have access to these medicines. They can't get it to buy. I have traveled elsewhere and I needed to buy a medicine for a condition I was suffering as at that time. And I roamed a lot of pharmacies and chemical shop. I did not get the medicine. And that's when I understood the problem of irrational use of the medicines. Okay. So please, we should ensure that people get their medicines only when we are sure they are having a condition and they need a medicine. The overuse, underused, or misuse of medicines results in wastage of scarce resources. Okay, people will need, and I assume that somebody has gotten malaria, and we need to get the person an anti-malaria drug to treat them. And you are roaming from pharmacy to pharmacy without getting the anti-malaria drug. And this person happens to be your relative, let's say your father, your mother, or your son, and you are going from pharmacy to pharmacy without getting, this person is running temperature. How will you feel? Okay, how will you feel knowing that a friend of yours has bought 10 packs of the malaria and it's in his room, he's not taking? He's thinking that, okay, in future I may get malaria. If I get malaria, then I'll take, or my wife or my child will get malaria. So this person have bought 10 packs of the anti-malaria medicines in their room, and patients are out there struggling to get some for their sick person. Okay, this is a problem of irrational use of medicine. It leads to wastage of scarce resources and widespread health hazards. All right, so in the pharmacy, we are not there to make money because we are just selling medicines. No, we are there to ensure that patients will get medicines that are appropriate to the clinical need. And this section is taking us to what then do we mean by rational use of medicine? If you say a patient should use a medicine rationally, what do we want to say? Now, RDU, that's rational drug use. Okay, rational drug use refers to when one, patients receive medicines appropriate to their clinical needs. Okay, when you say their clinical needs, for example, as I've used, if I have malaria, I'm supposed to give in an anti-malaria drug. Okay, for example, if I have malaria and somebody is giving me liver salt, Martin's liver salt, or I have malaria and somebody is giving me Posnol 2, why will you give me Posnol 2 if I have malaria? All right, I know the example I'm giving is extreme, but just to make my point, when we are talking about rational drug use, patients should receive medicines appropriate to their clinical need. If a patient is having malaria, they get an anti-malaria drug. If a patient is having a bacterial infection, they get an antibiotic appropriate to that type of bacteria. If a patient is having headache, they get a medicine that will be appropriate to relieve their headache. Okay, so the first thing that we know that we are giving medicines rationally, okay, is that we are giving the patient medicines that is needful, medicine that is useful, medicines that will be needed to treat the particular disease condition that they are having. All right. The second one, the dose that of the medicine that we are giving should meet their own individual requirements. This is very important. For example, I'm an adult. Okay, if I'm sick and I'm being given malaria medicine, the dose you are giving me is 4 tablets. If my son is sick and you are giving my son an anti-malaria medicine, the dose you are giving my son may be 2 tablets. All right, so you can see that the dose is changing for individual requirements. Maybe I am sick, I'm taking malaria medicine 4 tablets. If my wife too is sick, I am heavier than my wife. Okay, so my wife may be weighing 50 kilograms. I am weighing 80 kilograms. So even though the two of us we are adults, my wife will be taking 3 tablets of the malaria medicines, and mine will be 4 tablets of the anti-malaria medicine. Why? Because I'm heavier than my wife. So one thing we talk about in rational use of medicines is that the dose of the medicine we give to the patient should meet their individual requirements. The patient may have a problem with their liver. the problem they are having is different from my problem. All right. So we make sure that the dose we give should be the same dose for a particular patient. Okay, so that we don't say that if Mr. Bequin is taking 2 tablets of paracetamol, then the wife too to take 2 tablets of paracetamol. No. Maybe my wife's condition will not allow her to take 2 tablets of paracetamol. Okay, so we may reduce it and give her a 1 tablet of paracetamol. The third point in making sure that we give medicines rational is that the period of duration should also be adequate. Okay, here when you are treating malaria, we normally treat malaria for 3 days. Okay, so assuming I'm giving somebody anti-malaria medicine and the patient is taking it for a day or 2 days, it is wrong. That's the irrational use of the medicine. Why? Because they have taken it for a less period of time. However, if this same patient too takes the malaria for 3 days, comes again and buy another pack of the anti-malaria medicine, let's say Lonart or Coartem, or Lumitrust, okay, come and buy this anti-malaria drug. After finishing the first course, they say that, oh, I feel I still have malaria, so I want to take another dose. Okay, then this patient have extended the duration. Instead of 3 days, they are taking 4 or 5 days. That is also not rational use of medicines. Okay, so if the disease is supposed to be treated for 3 days, it's 3 days. If it's 5 days, it's 5 days. If you have been given an antibiotic to take for 5 days, at the end of the 5 days, that is all. We discontinue. Even where some of the liquid have been left, we don't take it again. The fourth point, okay, the fourth point is that also rational use of medicine should be at the lowest cost to their patient and their community. Okay, should be at lowest cost to their patient and their community. Now, what it means is that sometimes the cost, when you're talking about cost, we are not saying that the medicine should be cheap. No. Now, assume, let's assume this. Come along with me. Now, assume that a patient comes to your pharmacy and this patient comes with a condition like malaria. We want to test for the malaria. The patient says, no, I don't have money, so don't test. So because the patient says, I don't have money, we also did not test. Now, the patient may say that just give me an analgesic, a pain reliever, okay, or a painkiller. That's all that I need. The headache and the fever I'm having go. Me, that's how I am. So the patient will put pressure on us, and instead of treating the condition, we just give paracetamol to help with the headache and the fever. Now, this patient goes home, and let's say midnight, the condition becomes worse. Okay, once the condition becomes worse, the patient is going to be rushed to the hospital, and that is cost. 2, the doctor will have to ask them to do a folder. That is cost. 3, they are taking the blood to the lab. That is another cost. 4, this patient is going to be admitted at the hospital. Okay, and admission fees are coming inside. They are going to give injectables. Okay, so you see, the patient is going to stay in the hospital for about 3 days to about a week if it is malaria. We are going to give more medicines. They are going to do more laboratories. If you are not careful, we are going to transfuse blood because malaria can cause anemia. Now, how did this happen? This happened because this patient should have paid a low cost, do a malaria test, okay, for about 5 Ghana cedis, buy the anti-malaria medicines for, let's say, about 10 Ghana cedis, costing 15 cedis. This patient decided that, no, I don't want to do it. However, they decided to forego doing the test, and now the community will pay a high cost because by the time we rush the patient to the hospital for them to discharge, the family would have not spent less than 500 to 1,000 Ghana cedis. Okay, so looking at 15 Ghana cedis to 1,000 Ghana cedis, 15 Ghana cedis when we use the medicine appropriately, and 1,000 Ghana cedis when it wasn't used appropriately. Look at the cost that has brought on the patients and the community. And the last one, we add drug-related information. And in fact, this model we are going to talk about of drug information, we are going to talk a lot about it. Okay, most patients will receive medicines and they don't have any idea what disease the medicine cures. They don't have any idea the side effects of the medicines. They don't have any idea the adverse drug reactions of this medicine, which we have done already. Okay, so anytime we are dispensing medicines without adding drug related information to the patient, we have dispensed the medicine irrationally. All right. Now, how is this thing happening? First of all, we are saying that all drugs that are going to be prescribed by medical doctors or by qualified, okay, and registered prescribers, they should write the name of the medicine in the generic name or the international non-proprietary name, the INN. Okay, basically, we've said in our previous letter that a generic name is the name of the medicine. That's almost the same as the name of the active ingredient. Okay, an international non-proprietary name is a name that's accepted internationally. Okay, for a medicine, non-proprietary means that nobody holds the name. Okay, so I cannot say that this name is for my company. No. So brand names or proprietary names may be confusing if a doctor writes, okay, because I may not know, I may give a different medicine. Okay, so doctors are not supposed to write brand names. So for example, if a doctor wants to write a malaria medicine, a doctor cannot write Lunat or Coartem. What we are advising doctors to write is the doctor writes the original name of Lunat or Coartem, and that is Artemether lumefantrine. Artemether lumefantrine, all right. So this we believe can be able to help to cap and check the irrational use of medicines. Not only that, when we are also labeling medicines, okay, we are supposed to do the right thing. And look at this example. Now, this doctor have prescribed a medicines, metformin, 500 milligram, one tablet, PO means through the mouth, or twice a day. And we are supposed to give the patient for 60, okay, for 60. Now, let me ask this question. Look at the prescription that the patient has gotten. Now, that's the generic name that the doctor wrote. Okay, but we have a brand name like Enafage and Glucophage. Assuming we don't know, and the doctor writes Enafage, 500 milligrams, one tablet, the patient may roam the whole pharmacies in Accra without getting. Me, I may know because Enafage is a metformin brand from NS Chemist. Okay, Glucophage is also another brand, okay, from Mec Pharmacy. Okay, so because I've practiced a lot, I know. But if I assume you are a new MC, you may not know. You may decide to go and pick your BNF and check what is Enafage. And BNF may not have any record of Enafage because Enafage is manufactured in Ghana. All right, so if you're not careful, you may tell the patient that, oh, madam, please, we don't have any medicine called Enafage. This is because the doctor prescribed Enafage, but the doctor was supposed to prescribe the original name of the medicine, that is metformin. All right, so doctors are supposed to prescribe in the generic name or the international non-proprietary name, not brand names. So examples of generic names and brand names, just to let us understand the lecture, is, for example, a doctor should prescribe paracetamol. All right, there are brands of paracetamol on the market. One is Panadol and Tylenol. The doctor cannot write Tylenol or Panadol. He should just write paracetamol. The doctor cannot write a medicine like Septrin or Nestrin. The doctor should write cotrimoxazole. Okay, cotrimoxazole. The doctor cannot write Flagel, which I know a lot of you know. But the real name of Flagel, the generic name of Flagel, the international non-proprietary name of Flagel is metronidazole. Metronidazole. Others are Flagental. Okay, the right generic name is Segnidazole. We have another brand name like Advil or Brumed, what we call Brufen. Okay, the generic name is Ibuprofen. We have Piriton, and a lot of us always say, I'm buying Piriton, I'm buying Piriton. When a doctor is prescribing, the doctor will not write Piriton. The doctor writes the name chlorpheniramine. Chlorpheniramine. Okay, that's the name. Then I know a lot of us know Ryzen from Kinapharma, okay, and Histacept. Okay, so the doctor wouldn't write Ryzen. He would rather write cetirizine. Okay, cetirizine. Some people say cetirizine by cetirizine. Then we have Zental 1 plus 400 Tanzol. The doctor writes albendazole. Instead of Zental, he writes albendazole. And let's say somebody wants Vermox or Deworm, the doctor writes mebendazole. Mebendazole. Alright, so we are supposed to know this because sometimes doctors will write mebendazole and the MC does not know mebendazole is Vermox. Okay, so as time goes on, we'll be seeing some of these brand names and their generic names. Now, when we are labeling medicines too at our pharmacy, okay, the label of the medicine should have this minimum information to ensure that the patient does not use the medicine irrationally. One, every label should have the name of the patient on the label. This is important. So, assuming that I have been given a medicine and my name is on it, Magbequin, there's no way my wife can take the medicine. Why? Because my wife is not called Magbequin. If I take my kids to the hospital, okay, and they are giving them their medicine, they should write the children's name on the label. Okay, so they don't just give the medicine. If it's a syrup, you should write their names. Okay, so you write Kweku Asida, then another one is called Kweku Ayi. You write their names there so that the parent knows who the medicine is for. Without labeling the medicine with the name of the patient, sometimes the patient accidentally will take a medicine meant for another family member. All right. So anytime we are giving medicines to patients, anytime you are buying medicines from any pharmacy, you ask them to write your name on the label of the medicine. Two, we also write a generic name. If a patient is buying a medicine like Vermos, we should label in the generic name. We don't write Vermos. We write mebendazole. Okay. The strength of the active ingredient should also be written, and we have done this one in our last lecture. The quantity of the medicine you are dispensing, okay, should also be written on the label. How the medicine will be taken, that's what called a dosage regimen. Okay, any dosage regimen should be written there, or should be in graphic. Okay, sometimes they can just draw on it the name and address of the dispensing facility, and the dispenser should be there. Okay, so the name of the address, like for example, Fexen's Pharmacy is the dispensing facility. The dispenser is Mark Bequin. Then I also write my name on the label, so that if there's any problem with the label, the patient can trace it back to the facility that this is a facility that gave me the medicine. And two, the person that dispenses the medicine, the dispenser name will also be there. If there's any special instructions for the patient to observe, we write it there. The date that we give the medicine is written there, and the duration of use of the medicine is also written there. So this is a simple example of a foreign label. You can see the name of the pharmacy is the Smith Family Drugs. Okay, the address is stated there. You can see their telephone number on top. This is a prescription with the prescription number 123456 by Dr. Terry Brown. Okay, the name of the patient is Henry Jones. Okay, so the dosage regimen is take one tablet by mouth twice daily. And the generic name of the medicine is lisinopril and hydrochlorothiazide. Okay, 20 milligram, 12.5 milligram. All right, so this prescription has gotten label has gotten all the details by law, and this one will make sure that the patient is called Henry Jones. So it means that if you are not Henry Jones, you are not taking the medicine. All right, so labeling medicines well helps us to reduce irrational use of medicines. All right. Also, for us to check irrational use of medicines, medicines shall be dispensed by appropriate authority to do so. Okay, and this one means that, for example, we all know as MCs that MCs cannot dispense prescription medicines. We did it in Model 1. Okay, so authorized inspecting officers appointed under the Health Professional Regulatory Act, okay, 857, shall make regular visits or inspection of premises where dispensing operations are performed to ensure that provisions of this act are met. So when they come to the pharmacy, they want to know who is dispensing what. Okay, and as I've said, MCs can only dispense over-the-counter medicines under supervision. The medicine is a prescription medicine, you leave it to the pharmacist to dispense. Okay, so where a prescribed medicine for a given indication is not available, the pharmacist shall contact the prescriber for necessary modification. So the doctor prescribed a medicine like metronidazole, came to my pharmacy and I don't have the medicine, but I wish that, oh, I have another medicine that can do the same work as metronidazole. It's called segnidazole. Okay, segnidazole. But before I do that, I'm supposed to call the prescriber and inform them that this is what I want to do. If they agree, I continue. If they say no, I discontinue. However, where a specific brand of a prescribed medicine is not affordable to a patient, a pharmacist may substitute an equivalent generic form after informing the patient and prescriber where possible. So let's say that the doctor prescribed anti-malaria medicine like Coartem. Coartem is quite expensive, and this patient cannot afford the medicine. Okay, and I have one that may be less in price, like Lunat. If I want to change, I'm supposed to call the prescriber and inform him and let the patient know that I'm also changing their prescription. Now, why do we have issues with irrational prescribing practices? Okay, one, we have irrational prescribing practices of doctors, and that's why there's irrational use of medicines. Okay, some of our doctors, a few of them, will prescribe medicines irrationally. Sometimes patients don't need to take any medicine, but because of pressure from the patient will, doc, please give me some medicine. Then they will also prescribe something for the patient. Okay, some are doing it for monetary gain. Okay, sometimes some pharmaceutical companies put pressure on the pharmacist, on the doctor to prescribe. So doctors can write medicines irrationally too. Okay, they can also make mistakes. Two, irrational dispensing by pharmacists and other drug sellers. So sometimes if the pharmacists have gotten a pharmacy, some of them, a few of them, okay, a small number of them, want to sell the medicine to patients just because they want to make money. So medicines that patients don't even need, these people will give their medicines to the patient because they want to make sales, and that could be very bad. Another thing that can cause irrational use of medicine is drug pricing policies, okay, and also promotional activities of the pharmaceutical industry. Example, okay, if the medicines are very expensive, because patients cannot afford, patients go for medicines that are cheaper, and sometimes these cheaper medicines are even different alternatives, okay. So the patient has been prescribed with the medicine, but the medicine is so expensive, there's no alternative there. So because of that, they are not taking the medicine, or they are taking the wrong medicine. Promotional activities of medicines on our TV and radio stations is a lot, especially the over-the-counter medicines. People are promoting medicines, okay, and anybody who works in the pharmacy and they've had their adverts wants the particular medicine they had on that advert, and this one has also caused a lot of irrational use of medicines. Another one is lack of information, education, and communication on rational drug use to providers and consumers. Okay, to providers and consumers. So sometimes, sometimes the information about what a medicine can do, the dangers of such medicines, the patients don't know, and because of that, they are taking the medicine irrationally. So as an MC, as we said earlier on, after this training, you're supposed to educate patients that medicines can be very dangerous. Okay. Another one is lack of effective control and regulatory mechanisms on drug use, and also lack of political will and leadership to promote rational drug use. Okay, so these are some of the causes of irrational use of medicine. If the Pharmacy Council and Food and Drugs Board, which are regulatory bodies, will enforce it, a lot of people can't use medicine irrationally. Now, what can irrational use of medicines cause? One, it deprives the patient of the full benefit of available drugs, leading to poor patient outcome. Okay, so here the patient is supposed to have um, um, some outcomes on the medicine, but because that the patient cannot, and I'm saying again, cannot afford, okay, and they are not taking the medicine well, the medicine doesn't work, and their disease are not well treated. It can also lead to ineffective treatment and sometimes harmful effects or adverse drug reactions. Okay, so their medicine diseases are not treated well. Sometimes the medicine will react and they may even die. It brings additional burden on the household and the government. Okay, it increases the cost of taking care of somebody. It also increased morbidity. People have to be admitted at the hospital, and also it will also increase mortality. People will die. In antibiotics, it will increase the antimicrobial resistance. Okay, somebody is supposed to take the full course because they cannot afford. They did not take the full course, and this one will lead to expensive new generation antibiotics. Okay, so because normally we have done this one, a simple medicine like amoxicillin is no more working. You have to go for more expensive medicines, and it can also lead to non-sterile injections use, which may also transmit blood-borne infections. Okay. Now, what are some of the common misuse and abuse drugs you have seen in Ghana? Okay, so when it says they are misusing it, what that means is that they are not using the drug for the right purpose. When they say they are abusing the medicine, what it means that they are overusing the medicine. Okay, they are overusing the medicine, and this one is something we are supposed to really check, that people don't misuse and abuse the medicine. A few of these medicines that are commonly abused in Ghana is paracetamol. People are using it to relieve hangover. Please, let's not be giving it. People buy caffeine. Okay, normally drug addicts, they are now buying the energy drinks and APC, any medicine with caffeine they want. People are abusing antibiotics like amoxicillin, tetracycline. You see that my waist is paining me, my stomach is paining me, and some even open the capsule and put the powder in an injury, in a sore, in an ulcer. People are abusing sleeping tablets like diazepam and the rest. People are taking ephedrine tablets. Now we can't even get to buy in our pharmacy in Ghana, okay? Because it makes them feel high. People are taking steroids. We call them anabolic steroids, okay? For those who are bodybuilders, okay? And ladies are taking dexacortin, okay, or dexamethasone to gain weight. People are taking antifungal like grisoformin for skin rashes. And grisoformin is meant for ringworm infections and fungal infections, all right? But now, whether it's pimples or whatever, people are taking it. Okay, some places are taking it. Some are using herbal drugs and oral alcoholic beverages for meal performance in bed. And I know you know what I'm talking about. The adverts going on. I don't mention anything. Okay, abusing painkillers. Okay, and also abusing of appetite stimulants. Please, when we start to work in a pharmacy, I am begging you, please, let's not encourage this practice because it has led to the death of some of these patients and also has placed an extra burden on the pharmaceutical industry. Thank you very much. This is the end of part one. God willing, the next lecture will be on part two and looking at the rational use of medicine. After listening, please send me a message for me to know you are following the lecture. Thank you. Bye bye.